In a world filled with busy schedules and endless distractions, taking charge of your health has never been more crucial. Welcome to a journey of empowerment, education, and well-being with Health Check with Dr. Nooristani.
Welcome to another episode of Health Check with Dr. Nooristani. Breast cancer is a significant health concern affecting millions of women around the world. In the United States, it is the most common cancer among women and the second leading cause of cancer-related death. According to the American Cancer Society, in 2021, there were an estimated 330,000 new cases of breast cancer diagnosed in the United States alone. Breast cancer is a leading cause of cancer-related death in women. In 2022, it was estimated that 43,000 women in the United States would die from breast cancer. The lifetime risk of a woman developing breast cancer is approximately 13%. This means that about 1 in 8 women will develop invasive breast cancer at some point of their lives. The risk of breast cancer increases with age. The median age at diagnosis is 62 years, and about 2/3 of breast cancer cases occurs in women aged 55 or older. Today, we are going to speak with our special guest, Toby, a survivor of breast cancer and also with an expert in the field of oncology, Dr. David Palchak. Dr. Palchak received his doctorate in medicine from St. Louis University. He did his medical oncology fellowship at UC San Diego. He established an independent medical oncology practice since 1994. He established the region's first cancer research program, first nonprofit to expand services for cancer patients. We're gonna take a quick break. When we come back, we're gonna speak to our special guest. Are you suffering with an illness where you have to take regular medication that could impact you negatively in the long run? Are you tired of being sick? Is your quality of life diminishing? Being an internal medicine physician, for 16 years I have seen thousands and thousands of very ill people. Have you heard of the saying, doctor's orders? Well, good, because this is the doctor's orders. Go to balance7, 7.com and improve your quality of life. Toby, thank you so much for being with us today with Health Check with Dr. Nooristani. We know how important breast cancer is and how dangerous it is. I know you were diagnosed with breast cancer. So tell me a little bit about when did you find out that you had breast cancer and what kind of reaction you had to it?
Well, in December of 2017, actually, let's back up a little bit, right? I skipped 3 years. I skipped 3 years of mammograms, and it was a friend who kept on me to go, go, go. And so I finally went to have that mammogram, and I still put off, after they told me you need to go have a biopsy, I still put that off another 45 days. So it was early December when I got diagnosed of 2017, so about almost 6 years ago. I was at home by myself when the call came, and they can't tell you much about it when that call comes. They don't know what stage you are. They don't know what your treatment plan is going to be. So it's very scary, those first few months, really, until you get all the tests back. And I just can't stress enough how important those annual mammograms are, and to follow up if they say, hey, there's something suspicious here.
Now, when you were diagnosed, by the time you went in and see the physician, what stage were your cancer at?
I was lucky in that I was stage 1A, which means it's pretty contained, right? So I was able to just have a lumpectomy and radiation.
Okay,
Who
so
says
that's
they're
good.
lucky when all they had was radiation, right? Radiation's a big deal, but lucky in that it was small, caught early, it was contained, it hadn't moved to my lymph nodes.
And I think you'd be surprised. As I said, I've seen thousands and thousands of patients, And the importance of on-time, preventive services cannot be more emphasized. A month, 2 months, 3 months, a year make a big difference. In your case, maybe you didn't have the first 2 years and you got it right before the testing happened. So being very fortunate. Still, diagnosis of cancer is scary because you do not know, and especially initially. And not only that, for the remainder of your life, you have to be vigilant. So, after getting treatment, after getting radiation, it's not fun, and the surgery is not fun, and I've seen patients post-radiation. So after that, are you still going back on your regular mammogram, and how often you go to see, how often are you doing your routine mammogram now?
So I do a routine mammogram once a year, and I also see my radiation doctor once a year. So I get an examination 2 times a year. So that's good. And I definitely never, ever will ever miss a mammogram again.
Well, thank you so much, Toby. I think the message is clear. You gotta get your mammogram on time, and you have to do, simple thing like doing a self breast exam. It is really easy. Thank you so much for being with us, and I'm very happy for you that you caught it early and you got your treatment and you're doing your follow-up on a routinely basis.
Absolutely. Thank you for having me.
Thank you, Toby. Hi, I'm Dr. Ahmad Nooristani, a licensed physician that has been practicing medicine for the past 15 years.
Fact: millions of people suffer from low energy, joint discomfort, and overall poor health. People need healing from within their bodies. Balance 7 restores the body's natural defenses to improve joint discomfort, support brain health, and help sustain energy levels. See results in just 72 hours. Wake up and hit the ground running with Balance 7. Use code word B7 for your free bottle of My Smooth Skin.
I'm Dr. Nooristani. I endorse Balance 7. Welcome to the show, and thank you for taking time from your busy schedule, Dr. Palchak, to be here with us.
Well, you're very welcome. I'm glad to be here.
Well, thank you once again. So we know breast cancer, how devastating it is, and that is the leading cause of death in women from cancer-related issues. So before we jump into this important topic, could you just tell us what is cancer?
So the answer is a loaded statement. Cancer is an acquired genetic disease characterized by excess cell division and or failure of cells to die when they are supposed to. So let me take a minute to unpack that. So the excess cell division, I think, is what most of us think of when we think of cancer. So they divide more than they're supposed to, and they don't stop dividing when they should. This failure to die is the counterintuitive part of it. The most abundant source of house dust for people who don't own pets is dead skin cells. So our skin is constantly renewing itself, and new cells being produced, and old cells aging and then dying and falling off. And if the production of cells is dysregulated, then you wind up with too many cells too fast. If the cells don't die fast enough, then you wind up with cells accumulating when they should be dying and falling off. So both the production of cells and the death of cells needs to be closely regulated in order for our skin and other organs to function appropriately. So these are the cell division and the death of the cells is programmed genetically. And it's when a mistake is made copying those genes that you wind up with either excess cell production or a failure of cells to die when they should. And the whole reason this happens is because there's 6 billion nucleotides. Now, in the Zoom meeting, you can see the poster over my shoulder. In the audio portion, of course, we won't be able to see that, but the 6 billion nucleotides that make up the DNA of each cell have to be copied to make new DNA for a new cell. And anyone who's made a mistake dialing a phone number can appreciate that a cell might make a mistake copying those 6 billion nucleotides. So if a mistake happens in a gene that either controls cell division or controls cell death, then you either get excess cell division or a failure of cells to die when they should.
Oh, well, thank you for that. So just for clarification, whether it's breast cancer, colon cancer, lung cancer, it doesn't matter what type of cancer, the pathophysiology or the way the cancer is created is more or less the same.
Yes.
Okay. Now let's jump into breast cancer. Isn't breast cancer a hormone-sensitive disease, or there's more to it?
Breast cancer, I mean, there is more to it, but typically breast cancer is hormone sensitive with the growth of the tumors driven by estrogen. And so if you take the estrogen away, then you can typically stop the growth of the breast cancer.
Is that also, I mean, just is there a correlation between progesterone and estrogen? Is that there? I mean, there is a synergy between them, or dysregulation between those two hormones, or just specifically estrogen related?
Estrogen is the main driver. Progesterone typically stops the cell division of breast tissue, and progesterones have been used as breast cancer treatments. So we don't think of progesterones as driving the growth of breast cancers. So it's mainly estrogens.
Go ahead. I'm sorry. Go.
So it's mainly estrogens that drive the growth.
Is that so? The majority of treatments are targeted towards, curbing that estrogen cycle or interfering with that estrogen production, etc.
Yeah, so the estrogen blockers, I mean, the original was actually oophorectomy, and the second estrogen blocker was tamoxifen, and the next generation were these drugs that block the production of estrogen. Those all are effective for different periods of time and different stages of the disease. So in stage 4 or metastatic breast cancer, they typically control a breast cancer for 1 or 2 years. In earlier stages of disease, they increase cure rates appreciably.
We're going to take a quick break. When we'll come back, we'll talk a little more about possibly options for treatment. So we'll be right back.
Dear Balance 7, I'm writing to say thank you for giving me my life back. I'm 62 years old, and a few months ago, insomnia devastated my life. I had no energy, my mind was in a fog, and my memory was going. I was afraid it was dementia. My doctor prescribed a sleep aid, but it had side effects, and the sleep was never restful. I even resorted to remedies like acupuncture and a hypnotist. None of it worked. That's when I saw an ad for Balance 7. It claimed results in as little as 3 days, and I thought, what do I have to lose? So I ordered a quart, an 11-day supply. For 3 days, I took 1 ounce 3 times a day as instructed. The taste was odd, but I gotta say, not bad. By day 4, I felt amazing. I ordered a gallon, and 4 weeks in, I'm sleeping again. My energy is up, the brain fog is gone, and my memory is back. Thank you, Balance 7.
Balance 7 hits your stomach acid, producing powerful alkalinity, unlocking your body's immune system, releasing it from its acidic prison, allowing it to do what it was designed to do, keep you healthy.
Balance 7, where your body wants to be.
Welcome back. Dr. Palchak, since breast cancer is an acquired genetic disease, can we attack the genetic differences between the cancer cell and normal cells?
Yes, we can. And this is the type of cancer treatment that has always interested me the most. So those acquired genetic changes that cause either excess cell division or failure of cells to die when they should, some of those genetic changes are a result of enzymes, genes for enzymes that have been mutated. And so typically what happens is an enzyme that's supposed to be turned on briefly and then turned off is, in its mutated state, turned on continuously. And enzyme inhibitors are familiar to pretty much all of us. So to take one of the oldest examples, aspirin blocks cyclooxygenase and relieves pain and fever in a wide variety of conditions. And we know from our lived experience that aspirin doesn't cause the sort of bad side effects that my chemotherapy treatments cause. And so there is an expectation that if we have treatments that are aimed at specific enzymes driving the growth of cancers, that we could control the cancer with less side effects than my older chemotherapy treatments.
So currently, I mean, there's a lot of advancement in diagnosis and treatment of breast cancer. There are specific genetic markers that you guys are looking at when you're making that decision. And now recently, some of that are available for general public. I just want you to get your take because there's a lot of confusion with doing these testing, the genetic marker testing that are sent out literally anywhere now. Anybody could do those testing at home, which has great sensitivity and specificity, but the problem is interpretation of those data has become very convoluted, very challenging, and now we have some patient that comes in to me bringing in the entire list of things and what is normal, abnormal. Can you talk a little bit about that and how has it impacted your practice and what is the future of that?
So I believe that the test results that patients are walking in the door with, as opposed to those that you and I order, these are genetic tests that are describing the genes which we have inherited. So we inherited genes from our parents, and those genes are generally normal in quotation marks, which is a little different for each of us, right? Because we look a little different on the outside, we're a little different on the inside, and those differences are genetic. But most of those differences don't cause cancer. Only about 5% of cancers are related to inherited traits. The rest are these acquired genetic traits that are due to mistakes copying DNA. The inherited traits do sometimes come into play in cancer treatment. So PAL-B mutation or BRCA1 or 2 mutation in a pancreas cancer patient would make the patient eligible for a specific kind of a treatment called a PARP inhibitor, which amplifies the problems the cancer cell faces dividing in the presence of a PARP or PAL-B mutation. But that only pertains to 5% or so of cancer patients. The sequencing that medical oncologists are doing is sequencing of the cancer cells to identify the mutations that have occurred, not inherited ones, but that occurred as a result of copying DNA. And in the context of breast cancer, one of the mutations we look for is this PIK3C mutation. And those patients can be treated with an enzyme inhibitor, alpelisib, which increases response rates and survival and has really changed breast cancer medicine.
Thank you. We're going to take a quick break. When we'll come back, we're going to wrap up this discussion. We'll be right back.
What's up, guys? My name's Justin, and look, I'm a podcaster, a natural bodybuilder, and a personal trainer, and I need energy all throughout the day, and sometimes coffee just won't do it. But what I've noticed is this Balance 7 here gives me all the energy I need all throughout the day. It not only increases energy, but it decreases inflammation, and it boosts immunity. And also for the guys, you're gonna wanna hear this. It increases stamina. You need stamina. So if you wanna be better, and look, who doesn't wanna be better? Then go pick up Balance 7.
Did you know fatigue and energy levels are directly related to too much acid? Restore your vitality with Balance 7. Visit balance7.com or call 1-800-793-9039 to embark on a healthier lifestyle.
Welcome back. Dr. Palchak, we know immunotherapy is amazing, but only a small percentage of patients respond to them. Has there been progress in immunotherapy in recent months or years?
There has been progress, and one of the most, although in breast cancer medicine, the progress has been mainly in well-defined subsets of cancers. Probably the largest of those subsets is in breast cancers that express a little bit of HER2/neu. So 5 years ago, we broke breast cancers. We divided breast cancers into those that did not overexpress HER2/neu, which is a gene that encodes a receptor found on the cell wall, and those that do overexpress HER2/neu. And then a couple of years ago, we defined a third category of breast cancers that express a little bit of HER2/neu, make a little bit of this protein found on the cell membrane. And most advances in breast cancer medicine are made in stage 4 or advanced disease, and this is another example of that. And what we found is that in those cancers that express a little bit of HER2/neu, we can dramatically improve survival with something called an antibody chemotherapy conjugate. So this is a type of immunotherapy that's bound to a chemotherapy drug, but directs the chemotherapy drug to the breast cancer cell, where it's taken into the cell, and then there's an enzyme inside of the cell that cleaves the chemotherapy drug from the immunotherapy antibody, half of the chimera. And that since that chemotherapy is released in the cancer cell, it does most of its damage to the cancer cell. And the side effects are much milder than my old-fashioned chemotherapy. And so that has revolutionized breast cancer medicine, currently mainly with stage 4 breast cancer, because that's where we always test these treatments first. And then in the future, it will be this chimera will be tested in earlier stage disease. In fact, it is being tested in earlier stage disease. And I'm hopeful it will improve prognosis in early stage disease as well.
I mean, very excited about the immune therapy, obviously, and the opportunities for patients to enroll in different studies have significantly imploded over the last few years. I mean, there's so many new drugs that are coming up, and there's so many ways to get treatment. How does it work for a patient just getting recently diagnosed? What is the best way for them to seek the best option for them? Is that something that, in consultation with you, what they should look for, and where to find the right practitioner for that?
Well, I think we're blessed in our community with a very strong cancer program, and not just mine. I think the surrounding medical oncology groups are excellent. Bear in mind that we do cure 86% of women with breast cancer. And so the majority of women with breast cancer can approach their cancer with optimism and hope that they will be cured with standard treatments through their medical oncologist. Now, the medical oncologist is going to know if the patient has a poor prognosis breast cancer and should consider a clinical trial. And so I would ask the patient to find an oncologist they have faith in, and then follow the direction of their medical oncologist, because the medical oncologist can tell them their chance of cure with standard treatment and whether they should pursue something experimental or not.
And the last question, Dr. Palchak, are there any role of alternative treatments, including supplement, etc., in conjunction with chemotherapy? I know I'm a big believer that patients should be getting proper treatment via this chemotherapy, immunotherapy, but there's a role of any kind of alternative medicine or supplement in conjunction with treatment. Let me get your thoughts on that.
Well, by definition, the alternative and complementary treatments, or at least my definition, would be treatments that are not proven beneficial. So that doesn't mean there's no role. It just means that I don't know the role. Now, you and I have had some experience with the alkaline oral supplement, and we've seen some promising anecdotes, some promising case reports with that, and but I can't prove it, and so I can't promote that kind of treatment because I don't have that evidence. So my position is always, I'm not for them, I'm not against them, and patients have to make decisions in the absence of the kind of information that I have for these other treatments. So I wish I could get that sort of information.
Well, thank you so much, Dr. Palchak. It has been an amazing session. Hopefully, our audience and patients who are listening to this conversation learn a little more about their disease and what to do. We're going to take a quick break and we're going to come back with a conclusion. Thank you.
I was diagnosed with incurable lung cancer, stage 4, and given 2 years to live. I had one spot of cancer over here, about 50-cent size, and then big one over here, and my lungs were filling up and I had to get drained every 9 days. Within 3 months, 3 chemo treatments. I haven't had to be drained in 2 months now. This cancer is gone, and this one over here was about halfway, and it's got a different shape and smaller than what it was. So as far as I'm concerned, Balance 7's done a wonderful job along with the chemo. My hair's growing back. The doctor at the hospital was amazed at how much of the cancer had shrunk so fast. And that's when I told him I was taking the Balance 7, and he was really surprised about it. He just told me, don't change anything I'm doing, because whatever it is, it's working. I got a good appetite. Cancer can't live in a body with alkaline in it. So I just followed what Al said to do with it. I definitely recommend it to anybody, whether it's cancer, Alzheimer's, and heartburn. It's not just for cancer. I mean, you got any aches or ailments? That's what I'd suggest trying. Yeah, so if anybody's going through chemo and having a bad time with everything, and especially the side effects or something, you should give it a try, because it's definitely helped me. It's definitely a miracle cure for me. Never good to hear that you only have a couple of years to go, but like I say, I added more on to mine, I know, and I'll keep going.
Breast cancer is a dreaded disease. We have to be prepared and know what to do in order to prevent this from happening. So we have to be mindful of preventative services and guidelines that are available for us. Prevention and early detection are paramount in the fight against breast cancer. The American College of Physicians and Surgeons, in alignment with recommendation from other medical organizations, provide guidelines for preventive services related to breast cancer. Regular mammogram, clinical breast exams, and awareness of the risk factors are vital tools in the fight against the breast cancer. By following the recommendation of the American College of Physicians and Surgeons and adopting a healthy lifestyle, women can empower themselves in the battle against this disease. Early detection and proactive prevention can lead to improved outcomes and ultimately save life. Until next episode, stay safe and healthy.
Tune in to Health Check with Dr. Nooristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health. See you on the next episode of Health Check with Dr. Nooristani. The opinions and statements made by guests on this show are their own. Noble Productions does not constitute an endorsement or validation of what is discussed.